Uh, Good evening, everyone, and welcome to ATP Live Monday. I'm Bimi Boyde. It's my pleasure to be here today with you. Um, Thank you so much for joining us. And first and foremost, I want to say Happy Mother's Day once again to everyone who have not yet collected their Mother's Day's greeting from us. Thank you so much to all our mothers. You are amazing. We thank you for what you do. We, as pediatricians, especially, we value the mothers. You are our number one stakeholder in ensuring that our children live and not die. And so we are really, really grateful to the mothers. So thank you so much for coming. Thank you so much for joining me. As usual, the first thing I'm going to do is to try and share the videos so that everybody can join us. So thank you so much. Whichever platform you're joining us from, on Facebook, on Instagram, on YouTube. Um, Thank you so much for joining us. So let's just all share the video first. Um, After that, we will come back. I need to just make sure that okay, so we're live. Okay, so then we need to share to all our various groups. Welcome, welcome. If you are just joining us, you are on ATP Live Monday, whether you are on Facebook or Instagram or YouTube, you're welcome to ATP Live Monday. I am Bemi Salaboide, I'm a pediatrician, and I'm going to be your anchor for today's program. What I'm just trying now is just to share the link, the video, because to our various platforms so that everybody can see and everybody can join us. So just give me a couple of minutes to do that. And if you have any questions while we are doing that, feel free to um, start dropping your questions on whichever platform you're watching on right now. Um, okay, so I'm just trying to share the video to all our various groups and platforms. Um, so I'm just sharing, doing all the sharing and all the sharing. All right, welcome, welcome everyone. Feel free to start dropping your questions. I think I'm almost done with all my sharing now. I just need to pin them as well. And then, so that as long as I've pinned them, everybody can see, everybody can hear, and then we can start. Okay, I just want to be sure I actually shared the video, not the message. Okay, no worries. I'll just do that. Okay, my stories. Okay, can see what I shared from my stories. Okay, and then making sure I pin the video itself. Okay, let me just share to the page as well. Welcome everyone. I'm just doing all the usual sharing and pinning and everything we normally do. Just give me a few more minutes, and 1 minute actually, and then we're done. Okay. All right. So I think I'm done with all the sharing. I'm not quite sure whether for the I can't find my video on the page, but no worries. Okay. Okay, so let me welcome you once again. Thank you so much for joining me on ATP Live Monday. This ATP Live Monday is brought to you by Axi Pediatricians Foundation. It's an opportunity for you to ask any questions that you may have about the health of your children, and we will try and answer them in the next 1 hour that we have. But just for you to know that even if you have any questions after the live session, you can always post your questions directly uh, to our Facebook group. So we are always there all the time, Mondays to Saturday. So feel free, even when the live session is over, if you have any question, feel free to post your questions directly to our Facebook group. Okay. All right. Once again, for those who are just joining us, I want to say Happy Mother's Day to you all. We thank our mothers for being so amazing, amazing moms. We thank you for all that you do for our children, because without you, we will not have the children. So you are so, so amazing. Thank you for everything that you do for our children. Yesterday was the first of the Mother's Day. That's for those in the UK. I'm not quite sure which one we do in Nigeria, because we like we celebrate everything. But for those in the UK and other countries where Europe mostly, yesterday was Mother's Day, and so we want to say Happy Mother's Day to all our mothers, and we thank you for what you do, and we pray that God will continue to bless you, will continue to strengthen you to do more for our children. Thank you. We appreciate you. We pediatricians, we are the advocates, we are the voice for the children. And so we know that some of our babies are not yet verbal, they're not yet, I know some of them already told you Happy Mother's Day, some of them already give you lovely cards and gifts. But for the few ones that are non-verbal, I'm coming on the behalf to say thank you, Happy Mother's Day, and keep doing what you're doing, and you will live to hit all the fruits of your labor over our children. Thank you so much. All right, I think I've got my first question from Pierre. Thank you, Pierre. Say good evening, Doc. Thank you for this session. At what point should a baby see a pediatrician if a baby has fever, boil? Should it be a pediatrician or general doctor? Wow, that's a very lovely, lovely question. Actually, it depends on where you live. If you are in Nigeria, for example, I guess we will say you can see a general doctor. In Nigeria, in UK, and some other countries, everybody see their general doctors first, and then after that, if they think a pediatrician needs to see, then the general doctor will refer to the pediatricians. However, in places like the United States of America, every baby has a home pediatrician or his own pediatrician. So in places like US, for example, all the children will go straight to the pediatrician. The pediatricians are more like the general doctors for the babies as well. So every baby has their pediatrician right from birth. So in such places, you will just go straight to your pediatrician no matter what it is. You won't see any general doctor in between. So, but if you're in Nigeria, which I'm assuming, a baby who has fever, boy can see a general doctor. Number one, it's easier to see the general doctors than to see the pediatrician. We have more general doctors than pediatricians. I don't think we have up to 1,000 pediatricians right now in Nigeria. And with the jackpots, I'm not sure how many are remaining. So definitely seeing a pediatrician may be a little bit more tricky. So we are completely happy for our colleagues in general practice to see straightforward, simple issues. The child who has fever, boil, most likely just have a bacterial infection, most likely just need an antibiotic. So there's nothing special there. An average doctor will be able to treat that. So you can always see your general doctors for straightforward, simple issues. So like the one you just give example of, a child has malaria, those cough and catarrh, all those things our general doctors are very good in managing them. But once a child is having very complex health issues, usually that is the point where you come to see the pediatrician. And most general doctors also, if they think, oh, I'm not quite comfortable with how to manage this particular case, then they will refer you to us. If a child will need hospital admission, things like that, they will refer you to the pediatrician. But minor issues, you can always see your general doctors. But if some of people are under HMOs as well, and you have medical insurance, and maybe that is what your medical insurance recommend, that you use a hospital that has a pediatrician. So if you already are in a hospital where there's a pediatrician, most likely the pediatrician will see all the children in such private setups. But so it's really not a one answer fits all. It depends on your scenario. But if I just want to make it generic and as simple and as straightforward as possible, minor issues can be seen by our general doctors. Complex health issues, then you come to the pediatrician. So, Pearl, I hope that is clear for you. Yes, and even things that are really emergencies and stuff like that, please see a pediatrician. And while we're on that, I saw a question over the weekend about a child who fell, and the child actually had a seizure. And then the mom just do a first aid, and then the child was apparently okay, and the mom was just felt, oh, the child is sleeping, the child is okay now, there's nothing to do. I want to use that as an opportunity to change that. Any child who had a fall and an head injury and they have any other symptoms after that fall, they must always be taken to the hospital, no matter how minor, no matter what you think, how simple it is, no matter what you think that they have recovered. If a child had a fall and they convulsed, they must be taken to the hospital. If a child had a fall and they start to vomit, they must be taken to the hospital. If a child had a fall and they even just have what we call minor or mild loss of consciousness, maybe they are just a little bit disoriented, and they may not even have passed out or fainted, like we usually call it, they must still be taken to the hospital, because any head injury that is severe enough to cause a symptom, it means there is an injury in the head, in the brain especially, and it is important that we see those children. We must see them, because sometimes some of the symptoms may um be minor at the beginning, but something else is going on and something else can happen later on that may be even more severe. So, for example, a child can be bleeding in the brain, because the bleeding may be initially be small, so you may think the child has recovered and it's minor, but the bleeding may continue and the child may now have something more sinister happening. So we always want to see those kind of children. Most of the time, those kind of children, we're going to scan them. We're going to do a brain scan. We need to know what is going on in the brain before we will now say, okay, everything is well. We need to monitor them. We may need to monitor them for the first 6 hours, 8 hours. But if they are home with you, you wouldn't know that. You wouldn't know what to do. You wouldn't know how to monitor. There are what we call neuro observation that doctors, nurses will do in the hospital. So if a child had a fall and they cry and they got up, they are otherwise well. Maybe you just had a little bit of swelling and all that, and you put ice pack. Again, don't massage. A lot of us feel like any swelling, I don't know where that originated from, but any swelling, people always say we need to massage, we need to rub. Most swellings actually don't need you to massage them. Most swelling don't need you to rub them. Most swelling, most of the time, if they are bleeding, the swelling is from bleeding, you just need to put ice pack, because what you want to do is to stop the bleeding. So when you rub and massage, you're actually making the blood vessels to open up more. You are causing the bleeding to be worse. So we just need to apply ice packs, not to massage, not to rub them. Okay. So, but that is the first thing, and you can give paracetamol. But if the child is vomiting, the child passed out, even if they wake up later, the child is looking confused or disorientated, or the child is bleeding from the ears, from the nose, or the child is having what look like water coming out from the nose or the ears, that water is actually what we call cerebrospinal fluid. That is a fluid that supplies the brain. It means there is an injury in the head. There is what we call an injury to the brain, what we normally call head injury. That child must be taken to the hospital. That is not something you leave at home and so the child looks fine. I know this particular mom was not worried, but I'm happy she still took time to ask that question on our group. And so I use this opportunity to educate us. Once there's head injury, even if it is minor, we really want you to take the child to the hospital. Unless it's just the child who fell, nothing else, the child was fine, then you can leave that child. I hope that is clear. All right. PL, you're asking whether these doctors can prescribe drugs or medication. Why not? They can. They are doctors. I hope you know. So general doctors are fully trained doctors. They can treat anybody. All doctors are trained. So the first, before you become a pediatrician, you're also a general doctors. So all doctors are trained in treating people from zero to from cradle to the grave, like we say. So all of us have that basic training. All of us know the minimum to do for everybody, and all doctors can prescribe medications. All doctors. So there's nothing like it's only pediatrician that can prescribe medication. No, all doctors can prescribe medication for children, and all doctors can treat children actually. But there are some things that are a little bit more specialized, and that is when the pediatricians come in. So the general doctors always, yeah, they will even treat more children than even the pediatricians will treat. So they definitely know what to do. So I want you to be comfortable with children. Oh, you're asking about me. Okay, are you asking whether do you prescribe drugs or medication? If I see a child, if the child is my patient, definitely if the child needs medication, I'm going to prescribe. But if you're asking whether we prescribe group as part of what we do on our Facebook group or on our page, we don't. Okay, we don't. And I think I may actually go into the details of why we can't. Because a lot of people come to our group, they ask questions, maybe has A and B and say, please, what should I use? And that is the usual question that mothers ask. That question is not appropriate on a public social media platform. We cannot prescribe medication. Prescribing medication is a contract, I know a lot of mothers don't take it seriously, just think, oh, somebody will say, oh, my baby have this. Go and use that thing. Go and use that. They're referring to antibiotics. I'm not talking about over-the-counter medication like paracetamol, your vitamins, and all that. But I'm talking of drugs that have to be prescribed by doctors. There are reasons why certain drugs are not over the counter. There are reasons why certain drugs have to be prescribed by a doctor who is taking responsibility for that prescription. Okay. Number one, people can react to drugs. I hope you know that. There are what we call drug reaction. So before we even ask you to use, some people just go and use this. Did they ask whether that person is allergic to sulfur, whether that person is allergic to penicillin kind of drugs? Those are the kind of things doctor asks. Doctor don't just ask you to use medication. Number two, there are doses for medication. There's a particular dose to give for a particular disease. There's a particular dose to give for a particular weight of a child. So if we have not seen your child, how do we know the right dose to give your child? How do we know whether your child has some allergy to some medication? And some medication should never be prescribed for some children, because if you prescribe for them, they can actually just collapse and die. And that is how severe drug reaction can be. So those are the kind of things we need to ask before we prescribe medication. And number three, we can't just take your word for it that, oh, mom said my baby has this, has that. We need to see the child. We need to confirm, okay, that that is actually the truth. And so sometimes when people even ask me to comment about their doctor's treatment, I can't, because I don't know what your doctor saw. You are only telling me what you think, and the doctor may have seen more than what you have told us. So because of that, and for many other reasons that I may not even go into, we cannot prescribe medication in our group. So we can only advise you. So for example, if you ask this question, my baby is having boil and fever, I know your child needs antibiotics, but I cannot prescribe that antibiotic for your child for those reasons I've said. What we're still going to tell you is that you need to see a doctor who will see your child, weigh your child, confirm that the child actually had a boil, confirm that it's a boil and not something else. Because there are a lot of other things that may look like something, but it may not be. There are a lot of other swellings. Mothers will call it a boil, but it may not actually be a boil. So we need to confirm that that is actually the diagnosis, and then we can now prescribe appropriate treatment. And that doctor owns the responsibility of care. Okay, so that doctor owns the responsibility of care. If anything went wrong, it's that same doctor that should tell you, this drug I'm giving your child, these are the side effects to watch out for. This is what you do when you see this particular side effect. This is what you do. This is, if you see this particular side effect, you should stop the medication immediately and come and see me. If you see this particular side effect, don't worry, just keep going on, or do this or do that. Or if after 3, 4, 5 days your child is not better, come back and see me. That is that doctor who owns that responsibility of care. So treatment does not stop at us just giving you the drug. We have to also do other things as well. We need to monitor, we may need to do follow-up and all that. So for all these reasons and many more, that is why, ask the pediatrician, we cannot prescribe medication on our Facebook group. So if that is what you mean, I hope I have already answered that question. All right. So if you still have questions, those on Instagram, YouTube, feel free to drop your question. I can't seem to see any question going on, but while I'm waiting for the questions, I'll start talking about some of the word days that we have this month of March. This month of March is the World Sleep Day. There's World Sleep Day. We also have the World Epilepsy Day. Those are very important issues that affect children. I will talk a little bit about epilepsy, and then if you have any question, feel free to ask, because epilepsy is one condition people don't like to talk about, and people don't, we have a lot of what we call stigma around epilepsy. Epilepsy is also what we call seizure disorder. So some people like the word seizure disorder, not epilepsy. Some people don't mind, but I think in Africa generally people don't like epilepsy. Only you have somebody who has epilepsy, people always think it is something very dreadful. However, epilepsy is just like any other medical or health conditions. It can affect both children and it can affect adults as well. So in epilepsy, people have what we call recurrent seizures that is not associated with fever. So once you start having convulsions or seizure that happens more than 2 times and there is no fever, in other words, there is no particular cause of that seizure that we can immediately see, like fever or something like that, then we say you have epilepsy. Okay, somebody asked a question about that. I think the child had seizure maybe up to 3 times. One was with fever, but the other 2 are not without fever. And I was trying to explain that that child is having epilepsy. Okay, and usually when the child has epilepsy, that child has to be treated. Most doctors will say after the second seizure, unprovoked seizure, not associated with fever, we should start medication. Some people will say, okay, I just want to wait, because sometimes some children we just have the two and they may not have the seizure again, and we don't want to just burden the child with drugs. So some people will wait till three. There's no hard and fast rule, but all seizures are becoming recurrent and we don't want it to keep happening again and again. Then what we need to do is to put the child on medication. Luckily, epilepsy is treatable. Epilepsy is treatable. And so that is one fact that I want to highlight today. We have some conditions that will tell you we can't treat, or we know that it's going to end in death, like some cancers and things like that. But epilepsy is one of those conditions that we can actually treat in children and in adults as well. So first thing I want you to know is that epilepsy is treatable and it can be cured. In other words, people can stop having epilepsy. I've had children that we started them on medication, and after 2 years, they stop having seizures. Even before 2 years, they stop having seizures. But once we start the medication, which is why we're a little bit, careful when starting. Once you start, you can't stop. You have to go for at least minimum of 2 years. But after 2 years, no more seizures. We were able to wean off the child gradually off the medication. Again, epilepsy drugs, we don't suddenly stop them. We have to wean them off gradually. So we're able to wean the child off gradually, and then the child, eventually stop the medication. And most of them are still not having seizure again. So in other words, you can say they are cured of epilepsy or they are seizure free, and most of them will never have the seizure again. So epilepsy is treatable. Okay, epilepsy is not contagious. Epilepsy is not like COVID, it's not like measles, it's not like any of those contagious infectious diseases or communicable diseases, as we used to call them. So, in other words, if a child has epilepsy, they do not transfer epilepsy to you by you staying next to them, sitting next to them, or kissing, or using their cup, or using their towel, or using all those other items. So we don't, epilepsy is not contagious. I know a lot of people sometimes, don't let when some children have epilepsy, they tend to foam from their mouth. And people will say, don't let that foam come near you, or something like that. But actually, epilepsy is not contagious. So if the foam come near you, if the saliva come near you, it's not going to mean you're going to have epilepsy. So epilepsy is not contagious. So we should not we should not kind of discriminate or stigmatize people who have epilepsy, because epilepsy is not contagious. So we keep that. Another thing I really need to let you know about epilepsy is the fact that it's a problem in the brain. It is not a spiritual problem. It is not a witchcraft attack. It is not uh, a spell or something spiritual. Okay, epilepsy is just like any other health condition, but this time around it is happening in the brain, and which is just like any other organ of the body. And what is happening in the brain is that there is some part of the brain that is giving what we call abnormal discharges. It's just giving some signals, and it's giving it repetitively, and that signal is what now manifests with that seizure. So seizure can be motor, which we call convulsion, where the child is checking, out, they're growing stiff or things like that. But it could also just be the person zoning out, what we call abscess seizures, where they just kind of come back to themselves. So again, that's the form of seizure. We also have other kind of seizure. We have what we call complex partial seizure, where people kind of do things funny. But the one that most of us are familiar with is the motor, the conversion kind of seizure. But there are other kind of seizures as well. But one thing with seizure is that seizure is something that happens suddenly. Sometimes the person we know, so there's what we call an aura, like a feeling that something is about to happen. Sometimes they don't have the aura, but it just happens suddenly. It will have a clear beginning and it will have a clear ending. It's an episode. It's a what we call a paroxysmal episode. It starts suddenly, ends suddenly, and then the person may be fine in between, but it can happen multiple times. And if seizure is going on for too long, more than 5 minutes, or going on continuously without full recovery for up to 30 minutes, we call it status epilepticus, and that is in an emergency, because we need to stop. Because if somebody is convulsing continuously or having seizure continuously, and it's manifesting physically, not just in the brain that we're seeing on our EEG. It means the brain is not recovering, enough oxygen is not getting to the brain, and that can cause further complications as well. So it's very, very important for us to make sure that um, we have we stop the seizures as soon as we can. So what is causing seizure is that abnormal discharge in the brain. Now, why is that person even having the abnormal discharge in the brain in the first instance? Most of the time, let's just say more than 50, 60, 70% of the time, there is no absolute any reason, or we don't know the reason. So we call it idiopathic. In other words, there is no particular reason why this person is having this discharge in the brain. But sometimes as well, there may be reason. It could be that there has been an injury to that brain before, and there's a part of the brain that is injured that has some what do you call it? That part of the brain that has some kind of uh, 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 healing tissue or fibrosis, and because that part of the brain is like that, it means that part of the brain is prone to generating abnormal discharges. So, and that is what will now manifest as a seizure. Okay. Sometimes it could be that the electrolytes um in the in the blood, they are not normal, and so that can also cause seizure. Sometimes it could be that somebody has a tumor in the brain, and that tumor in the brain can also cause seizures as well, and that could also be the first sign that that is epilepsy. There are other reasons as well. Some genetic conditions are also associated with epilepsy, like it can run in family. So some people can inherit certain genes in their family, and based on that gene that they have, they can start having epilepsy seizures. So that can also happen as well. So there are many, many, many reasons why people will have seizures, but most of the time, we don't even know why they're having the seizures. So, but we will investigate. So that's why we do a scan to make sure is there any tumor in the brain. I remember a mom came to me. She think her child is having seizures and all that, and they've been treating the child. But I insisted that the child must have a scan of the brain. That is one of the investigation we're doing. Somebody who is having seizure. I think the child was about 3 or 4 years old at that time, and lo and behold, that child actually has a tumor in her brain. There was something growing in that brain, and that is what is causing the seizure. So quickly called my neurosurgeon surgeon friend colleague, and we had that child had brain surgery, and the tumor was removed. And the seizure stopped, and the child is doing well even till today. So that is how important it is for us to do scan. I know sometimes when we ask us to do some of these things, some of us think, oh, money and all that, but sometimes we need to do some of these scans to really know what is going on in the brain. Another test we normally do is the EEG to measure the electrical activity of the brain, because that electrical activity of the brain is what will help us to know what is going on in the child's brain as well. So it is very important to also do that as well, and that can also give us an idea of what kind of medications we should give the child and things like that. Again, these are all important things we do. But the good news with epilepsy is that most of the time we can actually treat epilepsy. Most of the time we can actually cure it. Of course, we have some very difficult to treat epilepsy, and those are the ones that we need to use multiple drugs. Sometimes we have to use some kind of diet, what we call ketogenic diet. Sometimes we have to do brain surgery as well. For those of you who are watch Gifted Hands, Dr. Ben Carlson, some of his surgery that he does is for people who have this intractable epilepsy, and sometimes he remove half of the brain and things like that. So we do have those severe ones, but those are the minority. Most of the time, children with epilepsy, we can treat them, and most of them, they do well and they do get better. Okay, so uh, epilepsy is not caused by spiritual problem. Epilepsy is treatable. Epilepsy can be cured, and epilepsy is not contagious. It's not spread from one person to another. It can run in families because it can be genetic, and more importantly, if a child has seizures, we have to take that child to the hospital, especially if the children have seizure without fever. Fever can cause seizures, but we don't call that epilepsy. We just call that what do you call it? We just call that febrile conversion. And some children have that between the age of 6 months and 6 years. The good news is that they tend to outgrow febrile conversion. So after by age of 5, 6, they will stop having seizures with fever. But if a child is having seizures without fever, and it has happened more than 2 times, that is a seizure disorder, that is epilepsy, and that has to be properly managed and treated. So I hope that has kind of given us an update on epilepsy. If you have any question about it, please ask. This week is we this month of March is also when we talk about epilepsy, because it is one of those conditions that is very common and it affects both adults and children. So the good news is that some children stop having seizures and they will outgrow it and they'll be completely fine. However, some will still keep on having the seizures even into adulthood. And so adults can still have epilepsy, adults can have seizures, and they also need to be treated as well. So I think I will just pause on that as far as epilepsy is concerned. I don't seem to have any questions going on. So if you have any questions, if you are just joining us on Facebook, Instagram, you're welcome. Feel free to ask your questions, so and I will answer them. This is ATP Live Monday, brought to you by AXI Pediatricians Foundation. ATP is committed to the health and the welfare of all children globally, and we do that online through all this health education information, and we do it offline through our community medical outreaches. If you have questions, feel free to ask, but I have just another maybe less than 30 minutes more on this live session, after which the live session will be over. But that is not to worry. If you are just watching the recording, in other words, you are not watching me live, which means you are watching after 7 p.m. on a Monday morning, Monday evening, you can always see ask your questions on our Facebook groups. Our Facebook groups are open Mondays to Saturdays, and myself and my colleagues and moderators will be there to pick up any question that you may have. Pierre, thank you for staying with me. You've been my only person asking questions today, but it's fine. Okay, so your daughter has hemangioma on her chest. We didn't see it at birth, but it's noticed at 3 weeks. Is there any if side effect? Okay, thank you so much for that question. The first thing is, for those who don't know, hemangioma, what does it mean? Hemangioma just means abnormal kind of dilatation or collection of blood vessels. So blood vessels are what carries our blood, okay? And there are three different kind of blood vessels. So we have the arteries, they carry blood from the heart to the rest of the body. Then you have veins, they return the blood that has been used up back to the heart so that it can be oxygenated again. Then you have the small tiny ones that join them together. We call them capillaries. So those are the three kind of blood vessels we have. Most of the hemangioma tend to involve the capillaries, the small tiny base. So sometimes when it's a little bit swollen, dilated, and there's a blood inside it, then that is what we call a meningioma. And now it can just be very tiny ones, just that you just see what look like a color discoloration, but it can be very big ones, like a big swelling that you will see. So the management of meningioma depends on whether it is tiny, or whether it's big, or whether it's causing what we call cosmetic effects or any pressure effects on where it is located. Luckily, most hemangiomas are very tiny. The fact that you didn't see this one when your baby was born and you're only seeing it at this point suggests to me already that it must be something very tiny, maybe just a little bit of color discoloration. So hemangioma, some will for get bigger and get bigger, and then eventually they will start to shrink on their own. So in most of the time, we don't actually treat hemangioma. The tiny ones, the one that gets a little bit bigger, but they are not causing any problem, and then because we expect them to shrink on their own. So that is the first thing to say. So for tiny hemangiomas not causing any problem, we don't do anything. We expect some of them to. They may initially get bigger. We monitor them, but eventually they may actually just shrink on their own. But some are very big, and for the big ones, those are the ones that can give us problems, because sometimes when they are too big, they trap blood, because blood is supposed to be flowing through all those vessels I told you about. But when there's the big hemangioma, that abnormal blood vessel collection, they can keep blood inside them, and that can cause some problems. So the baby may not have enough blood circulation, or they may trap some part of the of the blood cells, what we call the platelet, for example, and that can lead to bleeding. So those are the ones that we treat. Or it may not be that they are trapping blood; it may also be that they are causing a pressure, like maybe if they're in sensitive part of the body, for example, in the brain, in the eyes, or in the lungs. There are areas where they have that they can press on something very important, and that can cause problem. So if they are causing what we call pressure effects, we may need to take them off. Or sometimes they are in a place where it is unsightly, mothers don't like, everybody is looking at the child like, what is that on your face, or what is that? So if that is also causing what we call problem cosmetic issues, we may need to remove them. So the surgeons that tends to work with children with hemangioma are the pediatric surgeons. So because you didn't give me the details of your own particular child, so I can't answer that question of is there any side effects. So hemangioma, depending on where it is, depending on the size of the hemangioma, depending on even the type of it, because there are also different types of hemangioma, that would determine what will happen. But like I said, majority of hemangioma are small. They are not causing any problem. They are not in any particular place that is an issue, and so most of them will be fine. They will just keep monitoring, and after a while they just fade on their own. But if they're in places where it is causing serious problem, and it is causing pressure effects, then that is when we will need to see the surgeons, and that is when we will treat it. There are different ways of treating it: surgery, laser, even some other kind of drugs and stuff like that. But there are different ways by which we can treat hemangioma. And just to answer your last of the question, like when will it disappear? Nobody can tell you. No, we can't give you an answer to that question. We don't know. That is the truth. We don't know when it's going to disappear. We just know that it will eventually disappear. If it is not causing any problem for you or your baby, you will just monitor. If it's a big one, see your doctor so that they can monitor, and they may refer you to the specialist. But if it's a tiny one, your pediatrician will just monitor on their own, and they may not need to refer you anywhere. Oh, we got somebody from YouTube, Emil. Emily Anibe. Thank you so much. Good evening. Thank you so much. Welcome to ATP Live Monday. Baby Salaboyde, I'm a pediatrician. ATP Live Monday is brought to you by Ask the Pediatricians Foundation. As you can see behind me on my t-shirt as well. We are here to answer any questions that you may have about the health of your children. Um, and we just have another maybe a couple 15 more minutes to do. So this is an health education information platform, but not to worry. If you have any questions after the live session, you can always go to our Facebook group, Ask the Pediatrician Facebook group. You can drop your questions there, and we will answer your question as soon as we can. Of course, we only do health education kind of questions. So if your child is very sick, your child is very ill, we recommend that you take the child to the hospital. There are certain things that are emergencies, so we don't expect people to pose questions of emergency. If a child is not breathing or is breathing with difficulties, that child needs to be in the hospital. There's no point posting it on ATP. If a child is convulsing, for example, that child needs to be taken to the emergency room. If a child is bleeding very severely, that is something you need to take to the emergency. If a child is unconscious for any reason, that child needs to go to the hospital. So if a child had a major accident or fall, that child needs to go to the hospital. But if you just ask person like, oh, how do I feed my baby? How do I do this? How do I do that? How do I make sure my child is healthy? Those kind of prevention, because we are more into health promotion, health prevention. We are always happy to answer that. Okay. Finally, I can send message. I've been following up, but can't send messages. Oh, sorry about that. I'm surprised that you couldn't send those messages. Sorry, but I'm happy you're able to send your message today, Emily. So feel free to ask any question that you may have. And so while I'm always waiting for questions, sometimes I do just do some health talks. Okay, I do have a question from Instagram. Um, Chibuenyim say my 3-year-old was sick and was diagnosed with mumps. I remember giving him the MMR vaccine, so I'm still surprised he has mumps. Okay, what could be the cause and how can it be managed so it won't spread to his younger ones? Okay, thank you so much, Chibu Henyim, for that very, very, very important and very, very lovely question. Yes, I gave my child immunization. I gave my child a vaccine. Well, how come the child still have the condition? That is a very valid question that parents ask us. Now, let's start by saying that vaccines are very important. In fact, they are one of our most successful public health intervention and campaigns. You don't know how many lives we have saved because of these vaccines. You don't want to know. We've saved millions of lives of children because of vaccines. We've kept a lot of millions of children walking today because of vaccine. Those days, children have polio, they become paralyzed, they can't walk. But these days, all children are walking because even when they have polio, they don't even know they have it and they are fine. So the vaccines has been very, 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 very successful. It's one of our child survival strategies. At the beginning of the year, I talk a lot about child survival strategies. Immunization is one of them. Very important for us as pediatricians. We would rather prevent than start to treat, because prevention, as we all know, is always better than cure. Now, but vaccines are not 100% foolproof. Okay, in other words, the fact that we give your child a vaccine does not mean the child is now 100% protected against that particular condition. It is there's no particular vaccine that will give you that 100% certainty. That is number one. But number two, there are also other reasons why a child who has been immunized can actually still have that particular condition. That has nothing to do uh uh that have nothing, absolutely nothing to do with the fact that the vaccine is not effective. Now, let's start by saying that vaccines are produced in the factory, and then vaccines have they are usually have to be kept at a particular temperature. So they have to be, that what we call cold chain has to be maintained before vaccine, from the place of production to the place of administration. It is very, very important. A lot of the time, especially for those of us who take our vaccines in private hospitals, especially in Nigeria, where we all know that sometimes our lights and electricity supply is not reliable. So this is one of the reasons I'm always an advocate of taking your children to the health centers. Number one, it is free in the health centers. Number two, they tend to maintain the cold chain better than some of our private hospitals. So I'm not saying all the private hospitals, so some private hospital cut corners, we all know that for sure. So and mumps is not one of the vaccines we give in the health center, so we don't have MMR yet. So I have a feeling, of course, you must have taken your MMR in a private center. So the first thing is the vaccine given to your baby actually still viable as at the time your child took that vaccine? That is the first question we need to ask. Is it a viable vaccine? Okay, in other words, has the cold chain been maintained, and was it given appropriately? Number two, even the way we administer the vaccine, there are vaccines that we need to give into the muscles, there are vaccines we give into the skin, there are vaccines we give as oral drops. If we don't give the vaccine properly, it may also lead to the fact that the vaccine will not work properly. That's another thing. Another thing, the timing of giving vaccine is also important, because sometimes for things like moms, you as a mom, you may have protected your child with your own antibodies. So we tend to give some vaccines at the time when we expect that your own antibodies would have wear off. If we give the vaccines too early, it means that we may run the risk of your own antibodies attacking that vaccine, thinking it's a disease. Because actually, vaccine, what we are giving you as a vaccine is a modified disease. We are giving the part of that virus or part of that bacteria or a product of that virus or a product of that bacteria modified in a way that when you now get it, when we give it to the child produces a reaction as if the child is getting infected, but the child is actually not infected. But what we are giving is a dead or a killed or a modified form of that product. So if your body is still having antibodies against that particular infection that we're trying to protect, like in this case, mumps, your own antibodies can actually destroy the vaccine because it will attack it like it is a real thing, and that means that vaccine will not be effective. And also the vaccines, some vaccines we have to give multiple doses, because if you give one dose, especially the killed vaccines, it will not be enough to generate the. So some of us will take the first dose, we don't go for the second. Like moms, for example, MRI, you need to take at least 2 doses. So if you don't go for you go for the first dose, it will generate a little response. You have to go for the second dose to generate the maximum response. So the question is, did you take the 2 doses of the mumps or just one? Okay, so these are many other reasons why. So, but even if you have done everything right, in other words, you took the right vaccines, you took it at the right timing, you get the right number of doses, even with all that, vaccines are not 100% foolproof. In other words, once you get vaccine does not mean you will never have that disease. We will never promise you that. But one thing we promise is that even if you eventually have that condition, you are not likely going to have the severe form of it. You will not likely have the severe form of it that will kill the child. It's going to be something mild. So that is what I will say about that. And that applies to almost all the vaccines, because I'd ask these questions as well from people who say, oh, my child had measles. Then another thing before we even go further is to make sure that the diagnosis is correct. So sometimes people will say, oh, the child had measles, but the child actually didn't have measles. So in this case, you have to be sure that that mumps is actually a correct diagnosis as well, because it could also be a wrong diagnosis. So there are many layers to unpeeling it. Then if I just want to answer the last part of your question, which is how can it be managed so it won't spread to the younger ones? Spreading to the younger ones is not about managing the person who have the disease. It's about the younger ones not being exposed. And of course, as at the time you are knowing that your child has mumps, the younger one has been exposed, so it's already too late. What you should have done is that everybody should have been immunized. Even the younger ones, they should have been immunized. So if you have not immunized the younger ones with mumps, with MMR vaccine, and they've been staying together with the other sibling who has it now, they are already exposed. And it's just a matter of time whether they are going to have it or not. But if you have immunized them prior, as if you have immunized them as well, they also have taken their own vaccines, 2 doses of it at the right timing, making sure it is the right, well preserved cold chain vaccine, then they are likely going to be fine. So they may not likely have it. Luckily, mumps is one of those not too severe kind of viral ends at people can have mumps, but most of the people they recover within 1 or 2 weeks. We don't really treat it with any particular drugs. It's a viral thing, it's going to go by itself. Just make sure the child is taking a lot of water. You can give painkillers like paracetamol and let the child be at home so they don't go infect other children. But otherwise, people recover very well from mumps. Within 2 weeks, they recover. If a child has a swelling and they within 2 weeks they are not fully okay, it is not mumps. You have to think of other things because there are other reasons why children can have swelling, even things like what we call cancers like Burkitt lymphoma and all that. So sometimes people misdiagnose those conditions as mumps. So which is why actually if you are the one that is saying, oh, my child was immunized, so you have to be also careful that that diagnosis is actually correct. So that's just to say, but otherwise mumps is not one of our major worry kind of vaccine. I think moms were more worried about mumps in boys because it can affect their testes. That is the complication, and it can cause damage to their testes. It can affect ovaries in girls as well, but very rarely. These are rare complications. Otherwise, most children will have mumps, they get over it and they're fine. It's not something we're going to worry about. I hope that is helpful. Emiliano, you're asking a question. How do I get 500 questions asked by mom? Oh, that is one of my products. I think you are asking about these e-products. Let me see whether I can show you the picture of it. If this is what you're asking about, 500 questions frequently asked by first time mom. Okay, it's an ebook and it's available. Can you send us a message on our WhatsApp number? Can you see our WhatsApp number behind me? If you can just grab it, or I think you should also be scrolling. Did I keep the scroller on? I'm not sure I kept the scroller on. But it's something you can you can Okay, I've kept the scroller on so you can see our WhatsApp number. So it's all behind the thing behind me. Or if you come to our Facebook group and just simply ask how I want to get this product. First time mom, 500 frequently asked questions. I don't usually take time to promote all this product because that's not my primary purpose. I just wrote it to help mothers. What I've tried to do is to compile all the first time mothers, especially. I have a passion for them because they ask they can have to 10 questions in one breath, and they always want to ask so many questions. And so I used to I have a whole course package for first time mothers, and I also have a book for them, and it's an ebook. We used to avoid perish, but I guess I'll make it available as and I think it's also available on Amazon as well. So you can get that. And but if you send me also a WhatsApp message, I can send you the link on how to get it. And then if you want to buy it, it's available. All right, yes, it's available. Just send us a WhatsApp message and we will respond to that. Or if you ask that question on our Facebook group, it will be easier for us to reply and send you the links and everything as well. Unfortunately, I'm not very good with quickly getting it out. It's somewhere now, but to get it out to be a little bit tricky for me. But it's something, I think it's 10,000 naira, very not so expensive, so it's available. Just send us a message and we'll get it across to you. All right, I guess my time is running out. So thank you so much for those who have joined me today. And thank you so much for all our mothers. Once again, we'll say Happy Mother's Day to you. Every day is Mother's Day. Every day is Mother's Day, but we just celebrate you, especially yesterday. And I just felt like since I'm live today, I'll do it again. So thank you so much for all you do for our children. If you're just joining us, thank you so much. Welcome. Feel free to, I still have 2 minutes, but after this live session, please go to our Facebook group. You can ask your questions there. Mondays to Saturdays, we will always answer your question. Sometimes it may take us 24 hours, 48 hours, 72 hours max. We would have answered your question. Of course, if there's anything urgent, emergency, we don't do that. For anything urgent, emergency, please go to the hospital, and then the colleagues will attend to the call. And if you want to, most of the topics that we talk about, we've already address them. We have our website. You can read in details. Like today, I talk a little bit more about epilepsy because it is also World Epilepsy Day or Week in this month of March. You can read it. We have a podcast, Ask Dr. Gbemi ATP podcast, and you can also go to our YouTube channel. Just like Emily is on our YouTube page right now, you can really watch full videos on specific topics that we've done in the past. And then right now I've been doing a lot of reels. I realize our attention span can be quite short, so I've been doing more of reels, 1 minute, 2 minutes, available on our pages. You can also watch that and learn. What else? So we're on Facebook, we're on Instagram, we're on TikTok, we're everywhere. So follow Ask the Pediatricians to learn. And if after watching any of our or reading any of our articles, listen to our podcast, watching our videos, you have any question, feel free to post it on our Facebook group Mondays to Saturday, or you can always come on live with me every Monday, 6 p.m. West African time, and I will try my best to answer your questions. So thank you so much, everyone. Thank you, Emily, and I'm so happy you were able to join us today. And thank you, Pierre. Thank you for those on Instagram. Chibuen, who has questions, and even those who didn't have questions, but they were just lovely listening here. Thank you so much for joining me today. And I will see you same time next week, God willing. Have a wonderful rest of your evening. And it is bye from me. Bye bye.